Healthcare is a basic right for all of us. Doesn't matter who we are. We need and our family needs access to healthcare. And the great news is there's much more access now than there has ever been before. First of all, you should go to healthcare.gov to find out whether or not you are eligible for health insurance that is low cost under the Affordable Care Act. If you do that by December 15th, you can get your healthcare coverage by January 1. And it's even more affordable than before because both in the American Rescue Plan and then in the Inflation Reduction Act we passed back in August, we expanded who can receive health insurance and the cost of that health insurance. And it's amazing, but now 4 to 5 people who sign up can find a good plan for $10 or less. Prescription drugs are one of the biggest drivers. We pay the highest prices in the world, and yet the drug companies have the highest profits in the world, which is really outrageous. This is something I've been focused on for years. And we finally had the right president, Democratic House and Senate, that came together to took on the drug companies. And we are now going to have Medicare negotiate best price. And secondly, starting in January, just around the corner, if you're on Medicare, you're going to be able to get your insulin for no more than $35 a month. We will bring down costs. We're also capping overall costs per year for seniors. We're saying if the drug companies are raising prices higher than inflation, they're going to be penalized. There are a number of ways in which folks that have heart disease or Alzheimer's, particularly, or women who are reproductive health age are able to get more affordable care. First of all, for anyone on Medicare, there's a wellness visit every year that is fully paid for. It's free. What is also very important to know is that now it is federal law under the Affordable Care Act that you can't be discriminated against for a pre-existing condition. A lot of folks have been afraid to find out in the past because they may either lose their insurance at their job or have to pay more. So pre-existing conditions are now covered and you can get the care you need without worrying about being penalized in some way. We want to make sure that we are, first of all, completely implementing what we have passed for community mental health and addiction services, that it's real, it's available in every community for folks, as well as schools, as well as in other venues. We need to continue to make healthcare more affordable. I'm also very focused on home healthcare, which is something particularly coming out of the pandemic. We have seen more and more how serious and how needed that is as well. And frankly, in healthcare right now, we have a shortage of workers, of nurses and doctors and social workers, and both in mental health and in physical health, there's a real shortage. So I'm very involved in efforts to expand opportunities to support more people to become a part of the healthcare workforce. I believe healthcare is a basic human right. Going to healthcare.gov will help you see all the options that will help you get the health insurance you need.